Una well done, oh, women, oh. This our table, we still full on top, oh. See, they talk no matter they go. It don't still come to my notice, say, most cases, now women, then they take medication pass, then they take drug pass, then they go pharmacy, go buy drug, whether they need them more, they don't need them more. As long as it be, say, they get as their body be. Somebody tell them, say, as my body just be one time, now this is the thing when I take, and that's why you can't do me, you go carry her, you go find her. I better stop her. Waiting. They write for A fit no work for B, even if na the same thing. Now they hear so. Even if A, B, C to Z, all of them get malaria, not be the same thing all of them go need. And even if na the same drug then all of them go need, they go still be different how they go take am. There go still be difference on the different things when they go add to make sure say they well better, because everybody different, and wetin dey worry everybody be different. Because some people feel just say na only malaria, some feel dey be say diabetes join, some feel dey be say diabetes, hypertension join, some feel dey be say what they call am arthritis, diabetes, hypertension, malaria come join. You see how the thing dey go like that. So now they take and say, okay, you just thought say my body dey pain me like this, when I go last time for hospital, see wetin they give me. Now you won't go hospital, or you won't go ask a healthcare practitioner, or you won't go primary healthcare. No, my sister, not be so. Life you no get duplicate, because this medicine, as you say, am as it be so, all of them, you get what they call am for medicine, for pharmacy. They say all of them they call am as poison. Paracetamol self, vitamin C, even if na ordinary vitamin D, all those small multivitamin, all drugs can be classified as poisons if they not use them well, if they not use them appropriately, and if you go take am for wetin not be your own, or wetin no go fit treat the thing when they worry you, if it cause wahala. So I beg una, if body they do now like this, una first go for diagnosis. Diagnosis, una still fit discuss am with my healthcare provider. We in our community pharmacy, we dey here come discuss am with us. Not be everything we dey do. If you come discuss am, we don't look say see how it be. We get what they call clerkship. We provide pharmaceutical care for una. We go talk with una, see how it be, okay, fine. Now so like this, can't go see this medical consultant. They specialize for this thing. Then go do. If you reach there, if you say the thing not be in scope, it go refer you to another one. That's all the healthcare system be. But you must talk, come and say this. Some people you just go, okay, give me paracetamol. Some go say, give me prednisolone, paracetamol, diclofenac, all for one pain. Na danger thing be that too. Yeah, na danger thing. And it also gets something what they call hypersensitivity. That hypersensitivity, we say, if you get something when we say you they react to, if you be saying your papa never react to them, or your mama, maybe it is the one yourself you never react. At any point in time, you feel react to them, so you go be careful for the medicine when you they take. So when you reach medicine, even when they write them for you for hospital, self, you won't buy them for pharmacy and all that. Then I say, I beg, help me check them for there whether I get the one when we say I no go take. Then the pharmacist will come begin ask you, say, okay, you they react to this one. He will ask you some certain questions to make sure say you they free. If you get the one come out there, he will say, okay, who be your doctor? They will say, refer you back to your doctor. Say, okay, go tell your doctor, say so and so. Or if you they fear, if he accompany you, go meet your doctor. Say, see waiting this person talk. I don't know whether he tell you and everything. So he say, see waiting they talk. How you know how you go take a change am for am like that, so that you no go come begin to react to medicine when we say you're not supposed to take. That one dey ground. Then another thing too, some of them go carry medicine, particularly the one when be liquids, or the one with powder when they come in. But not be only children they use powder medicine. Make I correct that one. So they say, okay, syrup not be only for children. You get adults when they use the same syrup that they use for children. Only say the dose go different. e get some syrup like that that's okay, because the person not fit get some condition, make I not talk am too much. When we reach our counseling table, we will tell you how those ones, because adults dey use syrups too. So once those liquids don pass 2 weeks, abeg jejely put am for dustbin, throway am. No put am say e dey for fridge since make you use am. I dey see people go come, dey tell me say okay, paracetamol when dey open since, particularly for children, they say they give am. E first of you from there enter the pikin body. Even the adults sef, e first of you from there enter your body. Anything you take when e pass 2 weeks or don reach 2 weeks, anyone remain, discard am. And that will not mean say you must finish every medicine. Take am reach the day when they say make you take am reach. When you reach that day, you stop. Not talk say make you, the money when you take buy am too many, so make you not waste. My sister, wetin they call adherence and compliance, abeg make you comply, so that story that touch the heart no go enter the matter. And if you get any question after that time, say you don't take and reach that time, you see they get symptoms, never feel well, you go back to your prescriber, say see how I dey feel, oh, make I still continue am, or if the prescriber say you want make you continue, he go tell you. If you want make you change am, or rather if you want change am, he go change am for you. He go tell you how you go take do am. But for every of your medication question, it's when you don't understand and when you know how to do, if you come meet us for community, we go talk to you, we go ask you, we go find out the side effects, and then we go tell you. Another one when still dey inside be say, you know, say you get some food when you know they feel, you know they when not they align with some medication. So not be every food like that. They'll just say, okay, take this one with food. You just carry food back, take am with the drug. If you react to the drug, you get what they call drug food reaction. You get what they call drug reaction. I'm sure there should be drug drink reaction too, because some drinks contain some ingredients when not they go well with a medicine. For example, now they take paracetamol for waiting now. How you want to do that one? Work now. So they get reaction. So all those kind of things we go educate you on them. And if you see any side effect, the first you go drop the medicine first, and then run. Go meet your prescriber, or you come to us in community pharmacy. Say, see waiting, I take this drug, see how I dey feel, but don't stop am. They will go look at whether the drug really they cause the side effects for you or not. Meanwhile, since you don't stop am, we will still carry you back again, refer you to your prescriber, so that they go look am inside and then they go know how they go change am. Drug as it is sweet, even over the counter drug, vitamin C, collagen, one thing, not be everything like that you dey take like that. Ask questions, so ask questions. Our mamas, our sissies, our sisters. Because they say some people when they come for pharmacy, they will talk. When I go, they tell them, say this, they will say, okay, now this one, I just see them online, or this one, I just see them like this. And this one, they say, this person take and say, not be so. You go first sit down and listen. Even at the end of the day, you still want to still get that information first, make you hold am. So that you no go make mistake. Because making informed choices when it comes to your health and medication use, the person not the loss. Not be loss. When we dey grow up, they tell us say to err in the path of caution is not foolery. In other words, if you dey careful to dey do things so that you no go do the wrong thing, you no go get wahala, you not do anything wrong. Even if at the end of the day no wahala come. But it is good you do things according to the books, and we do them, well. Another thing too, when I would like to talk about is, why would we say women not they like to, look after their health, even when they don't take their drug, the correct one that they take them well, they will just feel say, okay, not with this one, we cannot take them. When complications when they come, instead of them to seek better, proper care, they will sit down begin to think, oh, not like this. No, not be so. You go seek proper care now. If you don't know what to do, go to your primary health care center. Go to community pharmacy, which usually is the first point of call for almost every health challenge and all that. They go refer you. They will refer you. Some people when be diabetic patients, so when be hypertensive patients, like that. If you get some complication when they come small, they'll just dey look and say na play. Before you know wetin dey happen, thing don dey worse. Sometimes not be everything that they catch winch for. You go still need to be very careful on what you do. Dey careful, dey intentional about your health, about the things you eat, the things you do, and all. As far as your health concerned, because health no be wealth. Who know where no dey fit go market, go do go find money. Who know where no go fit wear that fine cloth when he don sew. That gbedu, that ashwebi, you no go fit wear if you no wear na. And even if you say make you manage wear yourself, the way you go dey do body up and down for inside sef, you sef go tire. So you must make sure say you wear. If you wear finish, no matter the single cloth when you wear, you go come out fine. You go even dey buga for inside sef, and all the rest. So women, may we begin to try to take care of our health. Taking care of our health is not a punishment. It's not something what we go dey fear, not be anything. But when we well, everybody for herself, their mind go come down cool and say, mama well. As when mama well, they know say they go chop. Nobody say they go chop better food. Person they will go say, wetin dey do you? Okay, person she go even fit say, okay, you don't wash your clothes, you don't arrange your room, you don't do this one. Okay, which time you can't take, why you can't come by this kind of time? Because the time when a woman dey for house, ask her, everybody will begin to run around up and down, say, wetin dey happen now? This woman, this one you keep quiet, so anything wrong, anything. You get one video when trend recently, how children dey react to when their mama dey sick, and how children dey react when their papa dey sick. Make I explain am as e be. E no be say they love mama pass papa or anything, and the thing be say they are used to seeing their mother up and about. She doesn't complain. And then not only that, most of their challenges, now she they look into them, now she they help them and all that. So when she just sit there enough, you do they shake it, who will help them? So they'll quick make the woman get back to life, get back to her duty, so that they go begin help them. Now it was a selfish this thing, but it's the truth of the matter. If she's not well, the house will not function. So they had to take care of it. When the man says, daddy is always fine. And even if daddy know where mommy will take care of us, so we are covered. So that is the explanation. Not that the children were not happy, or not that they were not that they were happy that their father was not feeling well, not be saying they not care. But they know say since the woman will take care of her. That is just the truth of the whole matter. So mothers, when you know well, still take time. Let people for house know say you know well, and then also find time make you rest. Even me, I did guilty of that one. Big time guilty of it. Sometimes I even they wonder whether whether not crime for woman to rest. But I find that's not our fault, but still our fault, because we need to be intentional about our health. So for the last video when I talk about menopause, and there I talk rich. So after menopause, post-menopause will come. And that post-menopause time, 50s, 60s, and all the rest. One good thing about it, because women have been used to working and being active. So when they get past that stage of menopause, all the buzz of menopause, at post-menopausal stage, they are still strong and active and very functional. So that is why you see they are still strong, as they grow towards old age. But even as at that time, there are many things what you're supposed to do. You go eat well, you go rest well, and you go do your medical exams well. Medical exams, say you go do your medical examination test for eye, test for everything for body, make sure say you do well and all that and all. Then you will also make sure say you take the supplements and the food when the food when you suppose eat, and also the medication when you go, as well as the monitoring of those medications too. No talk and say after they take the medicine. No, it must be monitored. So if you reach one part, when they say you the thing don't come, that they will know how whether they will reduce the drug or whether they will increase the dose, or whether they go remove them or change them at every point in time. So these are intentionalities when you go bring into the growing up, and all. Now this part when I just talk about monitoring, it's not only for postmenopausal women, and for everybody, both men and women, girls and boys, and everybody. when they of reasonable adult age to manage themselves. But since now women we dey talk about, so that's why I say a postmenopausal women and all that. Now another very key thing about that time too now, worries, too many worries and all that. And I know say at that point they get another parts of that age when people, they talk about, there's a lot of myth about the sexuality of the woman at perimenopause and postmenopausal. Another video now go take talk about that matter, because nothing do the woman at every point in stage. Everything on your mind then day. And how your intentionality, the environment when you find yourself, the thing will not they worry you psychologically or emotionally, as well as your financial stability and status. All those things they come together for public health. They call them determinants of health, when they make a normal human being very healthy. So women are no exceptions. So at these different stages of a woman's life, it is very important and it is very good that she's intentional about it. Now, woman home money, not be any wahala. Now for her to dey well, when she dey well, you see what I don't talk since say, if woman dey well for her, everybody, if she dey well, everybody for her as well. Nobody, but if something they worry, I mean, go come, the other things go they affected, So environmental health is very important for her. How where she, they go, how should they get her recreation, her kind of friends, her social needs. Just sometimes we just work out, go someplace, just relax. You don't need to begin dance, jump up and down, every other. Just relax, just reflect on life, reflect on your next, good move and every other thing. And then those things like being in tune with nature, your environment and your surroundings. This is what we call holistic care. Another very good thing, we say exercise is very good for women. So it is one of the biggest and very reliable form of medication that you can think of. Yes, we know say the woman they active right from time they go into this thing, but that exercise, they do wonders. Apart from endorphins, when they do it, they help your circulation, they go on continuously. They help shape your body, burn the fat where you need to burn, shaping the muscles where you need to shape it. So as women they grow older, proteins, protein needs increases and all the rest, so that all the places when supposed to go round well, and all the rest. So exercise is very key and all that. And the exercise don't mean say you begin to run up and down or begin to jump or they carry weight up and down. No, there are simple exercises that you can do even in your room or in your office, even wherever you go to. The one very good exercise one I like, hey, Jesus is Lord. Now dance. So my sister, if you sabi dance, but if you don't sabi dance, shake your body, dance as you like. The person when sabi dance and the person when sabi shake your body, when we say his sweat come out, not be only say he go jump up and down, do somersaults. No, dance very well that fits your body and fits your health needs at that particular time and make it a routine. The fact say you work out, go work from morning, come back in the evening, you say that will not be exercise. Now walk, you dey walk out up and down, because when you are exercising, you are intentional. Your focus, is almost like everything coming together in congruence. Okay, make I speak for ordinary English. We say all your focus come together emotionally, psychologically, and then you begin to physically, even as you begin to do the exercises, you put things in place. Okay, I dey move my leg up and down. Now why which direction I want to move the leg now? Okay, which part I want to do now? My belly I want to make it slim down. Okay, how they feel now as they do it like that. It makes you very intentional, and then you guide yourself on a daily basis as you do and they go. Before you know what is happening, you're looking younger, your skin is glowing, and then you are well, and everybody around you is well, and you also be able to educate the next woman or the next person around you on how to do. Because exercise now both men and women, boys and girls, they need the exercise. Not mean say you go to carry weight, heavy load kind of weight. No. Now generally one do. Some people they do sports, some they do different ones, but anyone when say is good for you, that is not so exhaustive. Not when you go do fish, can't they breathe as you say what they call it, you run 1 million, 1,000 kilometers at the same time. Yes, you go get increased cardio activity, but not the one that you be panting or gasping for breath. All these things will help your circulation. And once circulation is good, everything when you eat, everything when you drink, that they work will get to their target site and everything is fine. Now, whether you like them or not, whether that's true or you think it's a lie, every woman at every stage needs a form of supplementation. Because some ailments when people they suffer from, not be necessarily drug they need though. Now some supplements when we say they deficient in. And to know how the person is deficient in, you will do tests. You meet your medical practitioner. He will send you for lab, this thing. You bring that, you interpret and you will know. Some people, the simple vitamin A, then they lack. You go turn to something else. Some na vitamin D, they need. Some feel you have say ordinary vitamin C, but some people still they react to vitamin C. I don't see people say they react to vitamin C, but anyhow, there's some forms of vitamin C when come and all that. Some of them feel be just normal things and all that. And why some people go say, okay, for diabetic patients, they chop this one, they chop this one. Well, diabetic patients, when are they look after? Those one that they counsel, provide pharmaceutical care for. I tell them, may they eat anything because they need the energy. Your brain need energy. Now carbs in it. That will not mean say make you go eat them in excess. Everything in moderation. So you go eat everything in moderation, and at the same time have time to rest, reflect, meditation. That is the spiritual determinant of health, where you need to meditate. You get sometimes they'll say, okay, New Year resolution. Why do people they do New Year resolution? They don't think, okay, I do this one, I make I do this. It's a time of reflection. During reflection, you need to know the kind of things when you want to align with for the new year. The kind of things when you want to do, your goals and all that. Okay, the ones when you do, when we say you never finish, when you need to complete them. And even as you never complete them, so you need to add some things to. So it's when you sit down, you meditate. That's when the holistic care comes into part, or that comes into completion, because everything you will think about your physical health, think about your emotional health, think about your psychological health, think about your environmental health, whether you will change the environment or whether here you want to have you want Jakpa, or whether you want Jakpa from Benin or to Lagos, or from Lagos to Abuja, or wherever you want to Jakpa to, or whether you work for a particular place and you won't move from that particular walk to another place. Those are environmental health factors. You now think about that one. Then you not think, okay, I don't go school reach. Okay, maybe na masters I don't get, I won't do PhD, or I don't do PhD. Okay, waiting next, and every other thing. So as they think about all these things, so go they align. As they align like that, you will get clarity on a lot of things. Okay, as it be, so family life, how it be. Okay, my relationship with my husband, how it be like this, my relationship with my children, my relationship with my in-laws, my relationship with my brothers and sisters, my relationship with neighbors, my relationship with my work people, how it be. If you change people. The only thing when you go fit change na yourself, or the only person you fit change na yourself. So you go know how you go begin to work with every other person, so that you go fit keep boundaries. So that those boundaries, everybody go respect them. At the end of the day, you get your peace. Then you get your peace. No be war. No be war zone, because everybody know if you be the same. If everybody behave the same, then which means now only one person, then the environment, or then that community. So the differences in everybody, they make everybody different. They make everybody good. But it is not assumed, it is expected that everybody work together for the good of each other, so that everything will be in good, everything will work well, and everybody will be happy, and the continuity of the environment, the good peace, of the environment, of the society, will continue to grow and all that. So women health, we know the fit talk and finish. Okay, I mean, you be woman when you say you be career woman and all that. How you go to manage your health, and how you go to manage, your work. juxtapose, okay, sorry, side by side with your work, how your work and life balance, how they arrange themselves and every other thing. It still comes down to, um, health awareness. You're awakening to your health needs as a woman. Don't throw it away. Say, okay, no. You will get some women, you see, when they're born, they just born, they won't do superwoman. I mean, they're not to say they're lazy. They just come back from labor ward, they won't begin do this one, do that one. My sister, you're not good though. You're not good, because you get what they call postpartum depression. So such women, when they're born, remember, every woman when born, they need support around them until she become strong. Not go begin they do all, allow anybody when they're around to begin do strong head, say you want me prove, say what do you want prove? You don't need to prove anything to anybody. The only thing you need to prove to anybody is say, you need to rest, look after your children, look after your home, look after yourself and get better. So because they see some people when they're just born from hospital, they don't run around the bike. So you don't get people they say, no, hey, they get so many things when they feel do now. You have riders, you call people, rider, go help me buy this one, come, go help me buy that one, come, and every other thing, get things, But again, this thing also boils down to financial health. You see how all these things, they interconnect and every other thing. So at every point in time, when you discover, say, this determinant of health they miss for your life, not be quarrel. Just quickly sit down, reflect, find out, how you can get help, and do and realign them to get a good health. Because all these things in all forms the basis of your mental health. And mental health is critical to your overall health. That is the basis. Because a lot of women need to have good, clear mental capacity to be able to function to the maximum and optimally in every sphere that they find themselves. Whether at home, whether at work, whether in parties, social gatherings, and everything. You need that mental clarity, health, wellness, and well-being. I don't talk plenty things today. I know so the matter not they finish. If you get the one when you want to talk about, when we say we not touch, so just drop out for comment session, so that we go, we will continue the whole matter. Because so when woman well, the community well. When woman well, her family go well. When woman well, the community go well. And when women are well, the nation is well and sound. Because now women they born both man and woman. And woman they nurture both man and woman. And women they raise both man and woman. So the health of the woman is key in society. It's key in society. And I'm glad that there are policies coming up each day to help the woman to fulfill the optimal health that she deserves. Okay, so make we stop here today. So put anything when you want me to talk about for comment section. I'll be Linda Iboy, community pharmacist. I'm always here to attend to you at any point in time. If you check my bio and then see what you can or how you can contact me for your pharmaceutical care, solutions and all at Wellness Reboom with Linda. Yes, we will reboom the wellness they do. Take care and have a lovely year ahead. This is Wellness Reboom with Linda.